If someone at the mine is hurt on the job, you should know where the first aid supplies are located. Start by making sure the scene is safe. Then initiate mine emergency procedures and use your first aid skills as necessary. Emergency procedures will include using the communication system at the mine to notify your supervisor or the safety person of the emergency. Call 911 or a local number depending on your mine's policy. If an ambulance or paramedics are called, someone at the mine should meet them at the mine entrance and direct them to the injured person. If you see a coworker with chest pain and who doesn't have an obvious external injury to the chest, always consider that he or she may be having a heart attack. The pain may be described as constant dull pain or pressure located in the center of the chest or back. It often radiates to the jaw, shoulder, or arm, usually, but not necessarily, the left arm. The person may suddenly start to sweat, have trouble breathing, become anxious or irritable, have a stomach ache, or begin vomiting. You should immediately call 911 or your workplace emergency number for assistance. Be calm, supportive, and reassuring to help reduce anxiety. The person should not move unnecessarily. He or she will probably be most comfortable sitting or semi-reclined. Keep the person from getting chilled, but don't overly warm them either. We have all choked on something to some degree. When a person's airway is obstructed by something, food, gum, tobacco, etc., it has to be cleared. Usually, coughing will dislodge the obstruction. But if the airway is completely blocked, the person will be unable to speak, breathe, or cough. If someone is choking, they usually clutch their neck. If the airway is blocked, the person will become unconscious and can die if prompt action is not taken. If the cough is weak or the person starts to turn blue or gray, the airway is probably completely blocked. Have someone call 911 or your emergency number while you lean the person forward and give them 5 back blows with the heel of your hand. Follow this with 5 quick upward abdominal thrusts. To do abdominal thrust, stand behind the patient with your arms around his or her waist. Make a fist with one hand and position the thumb side of your fist just above the belly button, but well below the rib cage. Cover your fist with your other hand and press your fist into the abdominal area with quick upward thrust. Continue this procedure as long as the airway is obstructed.